So my name's Chantal Baldwin. I'm a neurologist. I wear a few different hats, but I work in public at the McEwen Hospital and do some private work here at Memorial. My role with neurosurgical patients is perhaps managing things around the operation or after the operation. So mainly headaches and epilepsy are probably the main things I see patients for.
I'm Xenia. I'm one of the neurosurgeons. I work at the Children's Hospital. So I'm a paediatric and adult neurosurgeon. I also work at the Royal Adelaide, and my private practice is here at Memorial.
I'm Jordi. I'm the nurse consultant for paediatric neurosurgery at the Children's Hospital. I work with Xenia quite closely for our patients, and I guess my role is very much collaborating that care between the patients and the team that's involved in their care.
I think it's really interesting because if I think back early on in my career, looking at the neurology consultants, there was often only like the single female consultant working in the department. But I look at my department now and we're sort of at parity. There's equal numbers of female and male consultants. So I feel like I'm really fortunate in that there's not sort of something in particular that's sort of a very clear issue or something that needs to be fixed.
I think also, as women, there has been a change in culture, and I think we kind of create our own pathways now. You just need that little hint of you can do it, and then I think, there's a lot more confidence in women to push forward and I guess create that pathway for themselves these days.
Yeah, and I think perhaps in the past it's the idea that it's perhaps not possible or difficult is because of the construct around us that this is the way, to be a neurosurgeon, for example. This is the way that you can take on leadership roles in healthcare. Whereas now that the platform's more open for women, we're finding that we don't quite fulfill it in that traditional role model, but we do it our own way and and perhaps sometimes I would like to say even better.
Yeah.
Sometimes it is just that, lunch catch up, coffee, just talking about our day and the challenges of the day, or even the frustrations, the little annoyances, and then after lunch we're good. We're great to go for the rest of the day.
And I think for me, just having someone to call, because obviously we share the brain, but we also have very different expertise in the brain. So if someone comes in with hydrocephalus, and I'm just like, I don't know if there's something that I need to be doing, having sort of Xenia at the end of the phone, I can just call, can you have a look at the scan, can I run this by you? That's really, really helpful. And it's also really helpful for the patients as well, because they're not having to, then go see another person, have another appointment.
Yeah, absolutely.
Right. We see such extreme cases and not,
people are really unwell.
Yeah, people are really unwell, and we would all be lying if we say some days it doesn't take an emotional toll on us. In our industry, we see sick people, we see people pass away, we see, some kids or adults come in and not go home as the same person they were. So I think, you have to have an outlet, and I think this is where, that collaboration comes in, and it is the coffee. You have to have that outlet and the work-life balance to be able to do your role.
From my perspective and patients that I see, there's a lot of hidden disabilities. So there's some disabilities that are really visible if someone has had a stroke and they're hemiplegic. So it's very clear that something's gone wrong and that they have a disability. But a lot of brain injury, there's cognitive changes and mood changes that are not visible to the outside world, and I think that can be a really, really big toll on patients and patients' families.
It's funny you're going to say that, because when I was looking through the questions, I thought the same thing. They might go through a period of rehab, but just because they've been cleared from a rehab perspective, and yes, I'm paediatric thinking, but their schooling might be impacted for, we're talking months, if not years potentially, that fatigue level, and just because they look well from the outside doesn't mean they're not still facing symptoms and challenges with their day-to-day life from the injury that they had.
Mm-hmm.
Yeah.
And I think what I would tell some of the families, not just in children, you know, but also in adults with a severe traumatic brain injury, that it's almost like a degenerative disorder. That it's not just at one point in time, but we see sort of the evolving changes throughout their lives. You know, for those with a severe traumatic brain injury, so it's still, it's not just that injury that you see right now, but it impacts them for the rest of their lives, and things are constantly evolving as well.
I think from a neurology perspective, the group of patients that we would see most often with brain injuries is post-stroke, and the stroke sort of field is super dynamic. So over the last 10 years, we're now intervening for acute strokes. We're giving medication to bust clots. Interventional neuroradiologists are going up and pulling clots out and fixing strokes. So I think that's a really, really exciting area. People just being really aware of that concept of act fast, that, you know, neurological symptoms are really serious. Get yourself into the emergency department, because there's treatments that might be able to be given to prevent brain injury.
Particularly for me, when I'm talking to families and not so much patients because they're probably a little bit young, but lean on those resources. Take them. I know there's a lot of people that, you know, feel guilty about, you know, taking from other people, but like, now's the time to do it. You know, let those people around you support you and help you and guide you through this tricky, challenging part of your life. I think it's very easy to just go into an autopilot mode, and for me as a mum myself, you know, you can see how you kind of just get into a doing, but taking time and looking after yourself so that you can look after your family. From a paediatric side of things, I don't do adult nursing, so it's obviously very paediatric based, but lean on those supports, take the resources and just try and get through until,
I think it's really important. Carer burnout is a massive issue with any type of chronic illness, particularly neurological. So making sure that our carers are looking after themselves as well.
And I think for me, for families, I always encourage them to ask the questions.
yes.
Ask questions, as many questions as you need. And without sounding cliche, there really is no such thing as a silly question. And I actually really appreciate, and I use it a lot, there's some good resources about what questions to ask. You know, your specialists, your doctors, because sometimes I find, especially early on, families will say, when I say, do you have any questions? They're like, probably a million, but I just don't know what they are. And having exactly, and having that, you know, when you can have that resource to just look in front of you and go, these are the questions you can ask. These are the questions that, you know, you might be thinking about, but you just can't quite formulate the words. And it really, I find that really helpful for families, and I encourage them to look into it.